Hey everyone, it's Dr. Shalini Gupta at the Dermatology Laser and Vein Center, and today I thought we would talk about acne. Acne is such a common problem. It affects, believe it or not, 80% of people between the ages of 11 and 30 at some point in their life. And then even women and men over their 30s can still continue to have acne, and it's something like 15% of adult women continue to have persistent acne. So it is a very common problem that we have to deal with here at our office. And luckily we have all types of treatments for acne, from medications, from just maybe lifestyle control to different procedures that help both with the acne but then also with the acne scarring. So there are all types of causes for acne, some of which we don't completely understand. So acne can be genetic, it can run in families, and we see that often where siblings will have it, or one of the parents had severe acne and needed to be on Accutane and now their child has it. Acne can be caused by stress, where it is an effect of the hormones on your skin. It can also be an effect of just the sex hormones like estrogen, testosterone that are affecting your skin. It can be caused by poor nutrition or lack of sleep. It can be caused by certain diseases or by certain factors like gastrointestinal problems. It could also be product related. It could be related to a sensitivity to a product that you're either ingesting or using on your skin. So lots of different causes, and we always recommend our acne patients to take good care of themselves first and foremost, which means try to get good sleep, try to eat healthy, less processed foods, less sugary foods, perhaps even avoid dairy products because they do contain hormones in most of the non-organic supply. And sometimes milk by itself, even if it's organic, may be a problem for some patients. So try to watch and listen to your body, see if there are certain factors you can attribute your acne to, and then try to avoid those. Some patients are also a little bit overzealous in perhaps cleansing their skin. So acne is not a problem of dirty skin or not taking care of your skin, although I do recommend if you wear skin products or makeup that you do diligently wash your face twice a day, once in the morning, once in the evening before you go to bed, to get all of the dead debris and makeup and all of that off your skin, because those sort of things can cause a clogging of your pores. And that's where acne really begins, is with clogging of the pores initially. So once that pore gets clogged, then the dead skin can just start accumulating under the skin, and it's usually around the hair follicles. Also, if you are prone to acne, you might be producing more sebum or oil from your oil glands. So these are the little oil glands. This is a hair follicle here, and this is where acne begins, is around the hair follicles. So you can get plugging of the skin, and then this overproduction of sebum in which bacteria can start to grow. And when the skin is still intact over the sebum, we call it a whitehead. Now when that skin is broken and that sebum is now exposed to the air, it usually oxidizes, dries up, and turns kind of black. And that is what is known as blackheads. And we know that a lot of people like to have their blackheads removed, extracted, or try to squeeze them out. We caution you to be careful when you do such things because you could potentially cause more problems and scarring to your skin. This can progress to an inflammatory response from your body against the bacteria that is now growing actively in this overproduced sebum that is not draining because the skin is clogged. And this would be what we call a papule, and that can quickly go into a pustule where you have a more severe inflammatory reaction and this pus formation that's occurring within the nodule forming under your skin. Now these two types of acne here, when you have an inflammatory response from your own body, is called inflammatory acne. And this can proceed then further to a nodule, or you can develop what we call cystic acne. Now a cyst implies that there are skin cells surrounding this dead skin, sebum, and bacteria, and the cysts can sometimes pop, and when they do, then you are at higher risk of scarring. So these are the different types of acne. And the treatments for acne, besides of course taking good care of yourself and trying to do what you can at home to minimize it, is the use of medications. And so usually we start out with topical medications if the acne is not so severe. We can use things like benzoyl peroxide-based products, topical antibiotics, topical retinoids of different types. And then we have oral medications, which usually consist of oral antibiotics, birth control pills, and a medication called spironolactone, which is a diuretic, but I actually really like using it in patients who have hormonal acne, especially adult hormonal acne. And then we also have Accutane, which we reserve for more serious or more persistent cases of acne, or especially more cystic cases. A lot of our patients prefer not to be on medications. Now, sometimes we have to use the medications, but if we can avoid it, we do have procedures in the office which can help with the various types of acne without having to go on an oral medication or a topical medication, which can often be irritating to the skin, and oral medications can have other side effects, and some patients just don't like the idea of chronically being on a medication long term for obvious reasons. If you are on an antibiotic, but we do recommend taking probiotics with it. So the treatments we have, for example, if somebody has cystic acne, then I like to use a procedure called Thermage. Now, Thermage is most commonly used for skin tightening and skin lifting, in which it has a great effect. But what was noticed during some of the early studies or the early patients who were coming in for skin tightening, but also had cystic acne, is that their cystic acne was actually shrinking and going away. And the reason for that is that the radiofrequency energy that comes from the Thermage procedure stimulates collagen in the skin, which helps with the tightening, but it also helps to shrink down those sebaceous glands that are overactive in patients who are prone to cystic acne. So it dries them up, and it works in a similar fashion, I would say kind of like Accutane, which you have to take orally and can be a fairly debilitating medicine for some people in terms of side effects. So the Thermage is a nice, easy way to help improve cystic acne. Sometimes patients only need a single treatment. Sometimes you might need a second or possibly even a third treatment, but it is a great option. And the other nice thing about the procedures is that they help with the acne, but they also start working on the scarring by remodeling the collagen and the scar tissue under the skin. Another procedure I really like for all types of acne, from mild to severe, is photodynamic therapy, though we tend to use that more in moderate to severe cases. It has a bit of a recovery time in that after photodynamic therapy, you want to make sure you're kind of like a vampire for 48 hours. You want to avoid getting sun exposure, or actually daylight exposure, because it makes you very photosensitive. And when you do the photodynamic therapy, you should not be on any kind of photosensitizing antibiotics or medications either. But the photodynamic therapy involves coming into the office. We scrub your skin with medication to help get some of the dead skin cells off, and then we apply what is called aminolevulinic acid to the skin, and then we let that sit, the aminolevulinic acid, for about usually 30 minutes to an hour, and it gets absorbed by the actively dividing cells in your skin, and it gets absorbed by the sebaceous follicles. And once it's absorbed, then we wipe off the excess aminolevulinic acid, and then we either apply a laser or a light source to activate the medicine, and it causes what's called a photodestruction of that follicular unit. So very effective treatment actually. Usually we recommend doing about 3 treatments, maybe 3 weeks or so apart for each one. Sometimes we do them a little closer, sometimes a little further apart. And sometimes patients need fewer treatments and some patients need more treatments. It really just depends on the response. We can also use lasers like the YAG laser, which is a deeply penetrating wavelength of light that also can help to reduce sebaceous follicles. We also have something called broadband light, which has an acne filter, which is wonderful for reducing some of the more moderate type of acne in terms of the nodules and the little cysts that start forming. And it can also help with some of the redness and the pigmentation that is also a side effect of having acne in terms of the scarring. And then we also have the Q-switch laser, which I like to use for mild to moderate acne, and that can help break up the little white heads and black heads and clean out the pores. We can do carbon facials, we can do hydrafacials, we can do peels, we have microdermabrasion. So the types and numbers of treatments we have for acne are a lot in our office. And sometimes we'll even use Fraxa laser. So it really depends on the patient. It's a personal evaluation, and then we figure out what's the right mix of procedures or what's the best way to start to solve the problem. And of course, we really want to try to control the acne before we usually start addressing the scarring, so that we don't have to repeatedly treat more scarring from acne breakouts. Acne can be a very debilitating issue, as those who have it, I'm sure, understand. It can be socially awkward, it can make you feel self-conscious. Acne can also be painful or cause itching, and it can just affect you in so many ways. But luckily we have really good ways to treat it, both from a medical perspective and then also procedures, and then sometimes a combination. We usually do send patients home with something to use topically to maintain their acne on a long-term basis, and we can only hope that you outgrow it at some point in your life. So I hope that was educational, a little bit of information about acne, and you have a wonderful day, and we look forward to being of help.